So the treatment that my urologist had recommended to me was a radical prostatectomy. And he really went into depth of how the procedure would go. I told him that I wanted to know what he was going to do prior to operating on me, because I was hoping that I would sleep through the procedure and wouldn't have to listen to his explanation, which I'm glad to report I did sleep through the entire thing. But it was a radical prostatectomy, which was the removal of the prostate gland. And he did talk about some of the side effects. And I think when you're talking about prostate cancer, the potential side effects are always the thing that I think stick in the mind of people. I mean, you have cancer, you can also become totally incontinent, and you can also suffer from erectile dysfunction. Now, both of the erectile dysfunction and the incontinence have moved the yardsticks miles and miles and miles from where it used to be. I mean, with the nerve-sparing procedures that they do today, and some of the other issues and techniques that they use, those are becoming less and less of an issue. Now, they're still there. You have to be reasonable to expect that things are definitely not going to be the same. So in March of 2006, I packed up my little suitcase and headed off to the hospital in Halifax and was operated on, and it was a radical prostatectomy, which I felt was the best solution for me. Not necessarily may be the best for everybody else, but I think that's when you have to really sit back and allow your healthcare professional to kind of guide you in the ways that they're knowledgeable about. So I remember specifically, I remember going to sleep, and I remember waking up without a prostate. Waking up part was a real positive for me, but I also remember in the recovery room, my urologist coming in, and in that post-anesthetic haze that you go through in the recovery room, I remember him mentioning to me that they wanted to do some follow-up radiation, just in case. And I hate the just in case, because I really needed to know what the in case was. And understand afterwards, when they did actually operate on me, the degree of prostate cancer was a little bit more advanced than they had thought it was. And they just wanted to make sure that the radiation, which was the external beam radiation, would just cover anything that may still be in my system. And of course, again, that couldn't be done for 6 weeks after the initial surgery, because you needed to heal. So those two things combined were the things that now allow me to be a 7-year prostate cancer survivor.
Some prostate cancers are high risk, aggressive, and more likely to spread. Others are low risk, least likely to have bad outcomes. The biopsy says cancer, but current diagnostic tools provide limited information about how aggressive a man's individual disease is. So most men decide to treat prostate cancer immediately. Once treated, many men experience serious long-term side effects, like incontinence and sexual impotence. Immediate treatment isn't always needed, but right now a man can't be sure if his cancer is the kind that is likely to require treatment, or if he's okay to wait for now. What if there was a test that could determine how aggressive prostate cancer is? Genomic Health is developing a new test to do just that. By reviewing the underlying biology of the tumor and using genes from multiple biologic pathways, the test can predict the aggressiveness of prostate cancer when diagnosed, allowing a man to make a more informed treatment decision with confidence, taking care of himself with more information and greater peace of mind.